Hi Luna, I'm Dr. B. Nice to meet you.
Hello, nice to meet you as well.
So it looks like we're doing a head-to-toe assessment on you today, is that correct?
Yes, absolutely.
Perfect. Any specific concerns?
No, I just haven't had a head to toe done in a very long time, and I want to be on top of my health.
That's great. I mean, it's great to be proactive like that, and definitely good to have this done, at least every 6 months or a year to make sure. So I'm just going to run through a couple of questions for you.
Okay.
And just sort of start head to toe and ask you down. So starting with your head, how is your thinking and any problems with memory?
I haven't noticed any problems with memory, but I can get stressed out, especially at night, and I get headaches occasionally.
Headaches, okay. And where are those headaches in your head? In the front of your head or the back?
More towards the side, right
The
here.
sides? And just on that left side generally?
Mostly on the left side, yes. Okay. I also sleep on my left side, so I don't know, maybe it's because
Okay. Okay. And you always, so you sleep on your side, on the left side?
Yes, that is.
With your hands underneath your head?
With my hands, usually I make a pillow for myself with my hands.
Okay. Yeah, it definitely could be leading to some muscle tension, but we'll check it out. Moving down to your eyes, any vision issues, changes in your vision?
I do wear contacts, and I have astigmatism.
Okay.
But that has been constant over the years, so no recent changes.
No recent changes. And the contacts are the right prescription for you? They're working for you well?
Yes.
Okay. You're wearing them now?
Yes.
Moving down to your nose, any issues with dryness, dripping, swelling, not able to smell?
My nose is constantly running. I think I have allergies.
Okay, let's definitely take a look at that.
But no issues with my smell.
Okay. With your teeth, moving into your mouth, any issues with tasting?
No, none that I've noticed.
Okay. And now are you going to the dentist as well?
Every 2 months, yes.
Every 2 months?
Yes.
Wow. Okay.
I love
So
going to the dentist.
very good care of your teeth. And have you ever had any orthodontics, any braces or anything like that?
No.
So you have a very naturally straight smile. That's wonderful. Very lucky.
I was lucky.
Moving on to your neck, any pain or tension? You said you had those headaches. Does any occur in your neck as well?
Usually I do get tense, a tension right here.
Okay, so more in your shoulders.
Mostly after I work out.
Okay. And how many times a week are you working out?
I try to do at least 3 times a week, most of the weeks.
Okay, that's great. And what are you doing? Cardio, weights?
Mostly cardio.
Cardio. Okay, so that's that running, biking?
Running, biking. I do lift some weights too from time to time, but mostly cardio.
Okay. Any issues with breathing during cardio? Any issues with your chest?
No.
Okay. What about your stomach? You're having regular bowel movements?
Yes.
And any pain or bloating, certain foods, anything like that?
No, I've not noticed anything.
Do you have any allergies to food in general?
No, no allergies to food.
Or medication?
No.
Okay, great. With your legs, anything you've noticed? Any tingling, numbness, trouble walking?
I do hear a lot of clicking when I work out and I stretch,
Okay.
especially in my right shoulder here. But that has been going on pretty much my whole life.
Does it cause you pain?
No, no pain.
Okay, so it's just a sound.
Just the sound, yeah.
And lastly, your feet. Any issues with your feet?
My calves, the muscles there hurt a lot.
Okay.
Probably from running.
Probably, but we'll check. So if there's any excessive swelling or tightness or heat down there.
Yeah, that'd be great.
Okay. All right. Well, I think I have a good assessment to start and go forward. I am going to do a thorough check head to toe just in case there's anything you have missed. It seems like you're in pretty good health, but we want to catch anything early, okay?
Okay.
So I'm going to take a feel in your head. So just look forward for me. And I'm just going to do a general palpation. Any pain or tenderness when I do this?
No.
Okay. What on this side here where you have those headaches?
Yeah, right there.
Is that painful to touch?
A little bit.
A little tender?
Yes.
Does it shoot anywhere else in your head? Any radiation?
No, pretty localized.
Localized, okay. Right here.
Yes.
Anything down here?
A little bit, just a tiny bit.
Just checking through that muscle there. There's definitely some tension in that muscle.
Yeah, right there.
Your hair is very thick. Sorry if I'm pulling it all.
That's okay.
And any issues with this right side?
No, that's pretty good.
Okay. I'm going to take a look there. Just make sure there's no visual bruising or anything I can see. Just turn your head towards me slightly. Perfect. So it starts right about here.
Yeah, right there.
I don't see any bruising or swelling or redness. While I have this, I'm just going to do an overall check of the scalp. Wherever itching or flaking the head?
During the winter time.
I'm not seeing anything right now. You're just tilting your head down for me, please. Thank you. Hair is nice and healthy and thick. Doesn't look like there's any color changing. Okay, go ahead and put your head up. I'm just going to take a look at split ends. I'll fix that for you. Got beautiful hair.
Thank you.
No major breakage. Are you using heat on your hair ever?
Sometimes as a straightener.
Okay. It's very thick and there's not too much breakage at the end, so I think as long as you're using some sort of hair mask or protectant after, or whatever you're doing is working fine.
Yes, I do use oil.
Okay. Oh. Let's just take an overall look at your face. I didn't see any injury for that side of the head, so that's leading me to believe it's either some swelling or muscle tension. So we'll keep moving on with the exam, but I will keep an eye on that. So just look forward for me. I'm just going to look at the skin itself. Have you ever had any moles or freckles, lesions removed?
Yes, I've had a couple of moles on my body that were removed because they were not looking too
Okay,
good.
so you do have a history of that. And are you visiting
Yes.
a dermatologist?
Every 6 months, yes.
Perfect. Skin looks really clear. Just a couple of freckles on the face, but they all look small and flat. Nothing to be concerned about. Eyebrows look nice and symmetrical. Hair's even distributed. I'm going to have you make a couple of faces for me.
Sure.
Just want to check the symmetry in your face. Can you smile for me? And frown. And puff out your cheeks and don't let me push them in. Okay. And raise your eyebrows nice and fine. Good. And then close them nice and tight. Don't let me open them. Okay, good. Strength is good there. I'm going to have you open and close your jaw for me. A little bit of clicking there. Is that normal for you?
Oh, yeah, usually.
Okay.
Unfortunately.
You said you're kind of a clicky person, right?
I click a lot, yes.
Yes. Well, everyone will hear you coming at least. Just feeling that muscle. Can you do it one more time for me? Just clench. Okay. Muscle's good. Okay, and eyelashes look good as well. Any problem with hair loss there?
My eyebrows, no.
No. Look into your eyes, so just look straight ahead for me. I'm just going to shine a light and just ignore it. Pupils react. Shine right in the middle here and come in. go ahead and stare at the tip of my pen. Just, is it double vision at all right here?
No.
Okay, follow everywhere it goes, just with your eyes. Don't move your head. Any double vision with this?
No.
Any blurriness?
No.
Okay. I want you to look at the pen, and then look past me at the back wall. Ignore the pen, ignore it. And then look at it. Good. Okay. And look at the pen now, and just follow it in. Good. Everything reacts perfectly with that. And look a little closer into the eye. So I'm going to get a little bit close here. So apologies. Just stare straight ahead though. Okay. Same thing on the other side. All right, that looks fine. Got a little eye chart for you here, and you said that you can see fine with the contacts, right?
Yes.
So both distance and up close, right?
Yeah.
Okay. So I'm going to have you read this line here with both eyes.
EPTZO.
Great. And can you cover one eye and read it backwards for me, please?
OZTPE.
Okay, cover the other eye. And try this line down here. See that one?
CFDHJ.
Perfect. Okay, no vision problems. Just check the pupils, and you're at about a 4. There's a little bit low light in here, so that's totally normal. I'll give you this card. I want you to cover one of your eyes. You can choose which one to start with. I'm going to cover that same eye, and I'm just going to have some fingers coming into view. Keep staring at me, and just tell me when you see it. Say yes when you see it.
Yes.
Okay.
Yes. Yes. Yes.
Okay, switch eyes for me, please.
Yes. 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 Yes.
Okay, and now with both eyes, I'm going to do the same thing, but just stare at my nose and tell me which one's wiggling, left or right.
My left. Left. Both.
Mm-hmm.
Right. My left. Both.
Good, very good. Same thing, just tell me how many fingers I'm holding up.
2.
Okay,
2.
good.
1. 4 in total.
Perfect. Okay, so no problem there. And while I'm having you do some math, I'm going to ask you a couple of logic questions.
Okay.
So, can you tell me what you had for breakfast this morning?
Cream cheese and a toast.
Okay. And can you tell me who the first president of the U.S. was?
George Washington.
Perfect. What was your favorite subject in school?
Mathematics.
So your short-term memory, your long-term memory, and your information gathering seems to be totally intact. If you were to find a crying baby on the street, what would you do?
I would call 911.
Okay.
Call the police.
So your decision-making seems to be intact as well. I'm going to have you add up some numbers for me. So what's 5 plus 7?
12.
Okay, and plus 7 again?
19.
Perfect. Can you spell cat for me?
C-A-T.
Okay, and what is a cat?
An animal.
Great. So all of that seems to be intact. You're thinking, you're able to process that information correctly. I'm going to show you a couple of cards here, and I just want you to tell me the shape and the color. This is also going to test some color blindness here. So tell me the shape and the color.
It's a green heart.
Okay.
Purple triangle.
Very good.
Yellow star.
Excellent. Just do one more.
That is a black oval.
All right. So Luna, looks like your thinking is totally intact. Your vision and your color is intact. I'm just going to take a look into the nose and put some gloves on for that. You said no trouble smelling, but a little bit of swelling and stuffiness, right?
Yeah, all the time.
Okay. Now have you breathe in for me? Okay, a little bit of occlusion there, definitely. Let me take a look into that nose. Just tilt your hat for me, please. There's a bright light. Definitely can see that swelling. The left side is worse than the right side. Okay, head down. There's no redness though. Doesn't look like you said, it's probably allergies. Doesn't look like there's any redness or chafing in that way. I would guess it is just a little bit of that histamine reaction. I'm going to give you something to smell. So just close your eyes for me, and I'm going to give you a scent.
Mm-hmm. It smells like lavender.
Mm-hmm. Same thing here, close your eyes for me.
Coffee.
Mm-hmm. Okay. That's great. Let me just palpate really quickly. Any pain up here?
No pain.
Just a little discomfort with the swelling there. Any pain in the sinuses here?
No.
What about right here?
No.
I'm just going to feel the face. Let's check the lymph nodes while I'm here. Can you shrug your shoulders for me? Okay. I don't feel any swollen lymph nodes again. Another good sign that it's probably allergies and not illness. Just take a quick look at the ears. Any pain when I touch the ears?
No.
But on that right here?
No.
Okay. Go ahead and take a look in them. Nice and clear. They look great. Yours look really clear. So whatever congestion you're having in your nose does that seem to be bothering your ears at all? Are you having any hearing loss, anything like that?
No.
Let's just do a couple of tests. I've got a tuning fork here. I'm going to hit it and put it on the top of your head. I want you to tell me if you hear it more left, right, or equally.
It's pretty equal.
Okay, perfect. I'm going to put it on the back of your ear here. Tell me when it goes away, when you can't hear it anymore.
No.
Can you still hear it there?
Yes.
Same thing on the other side. Can you hear that?
Yes.
Tell me when it goes away.
No.
Can you hear it up here?
Yes.
Right. So your bone conduction is a little less than the air, and that's perfect. Now, if you close your eyes, I'm going to make some soft sounds next to your ears. Tell me left, right, or both.
Right. Left. Right. Both. My right.
Mm-hmm.
My left.
Okay. Perfect. Perfect. Okay. I'm not worried about your ears or your hearing at all. They look great. So let's just take a look at the mouth, finish out the face. Can you open up and say ah for me? Okay, palate rises. I'm just going to quickly take a look at the teeth here. You said you go to the dentist often. They look great.
Yes.
And we checked out that jaw. I'm just going to give you something to taste. So I'm just going to give you a little bit of spray here. What do you taste?
That's like citrus, lemon.
Yes, perfect. So all of the senses are intact. I just want to check out your sensation now in the face. sanitize my hands. Right, so I've got a little bit of a soft touch there. Do you feel this on your chest? Does that feel soft to you?
Yes.
Okay. Close your eyes and just say yes when you feel it.
Yes. Yes.
Does that feel the same on this side and this side?
Yeah, same sensation.
Mm-hmm. This side and this side feel the same?
Yes.
Okay.
Yes.
Feels the same. And you felt it on both sides?
Mm-hmm.
Okay. How about that? You feel
Yes.
that? Okay. I've got a slightly sharper side here. I'm going to do the same thing. Just tell me if it feels the same roughness on both sides. Does that feel as rough as that?
Yes. Yes.
And that feels the same?
Yes.
Just going to do a little puff of air. Just want to make sure you can feel that.
Yes. Yes.
That's fine. Open your eyes for me. I'm just going to do a little bit of a reflex here. Good. Good blink. Good blink. All right, lastly, I just have this, it's much sharper, so just give me your hand. It's much sharper on that side and dull on that side, right?
Mm-hmm.
So I want you to just close your eyes and tell me sharp or dull.
Dull.
Mm-hmm.
Sharp.
Good.
Dull. Sharp.
Mm-hmm.
Dull. Sharp. Sharp. Dull.
Mm-hmm.
Dull. Sharp. Dull.
Okay. And does this feel cold to you?
Yes.
Cold on that side?
Yes.
Same here. And here.
Yes.
And here. And here feels the same cold?
Yes, same cold.
Okay, perfect. I'm going to move down to your neck now, Luna. So I felt a little bit of those lymph nodes before, but I'm just going to have you, can you swallow for me? Good. Swelling there. You said there's some tension in your shoulders, right?
Yeah, usually.
You can feel the muscle tightness. I'll take a closer look at that on the back, but I just want to have you move your shoulders for me. Can you move them around, shrug them up for me? Can you push against my hands, resistance? Okay. And this way, turn towards me. Turn your head towards my hand.
Okay.
Pull me, push. There you go. And this side, don't we? Push. Push forward. Push back. Okay, good. And any tension in the neck when I did that?
A little bit, maybe. Not too much.
Not too much. More just the muscle tension and not like a sharp shooting pain down the spine.
No sharp shooting pain, no.
I feel the joints here. You got some. You're cracky in the elbows too, you said?
I'm clicky everywhere,
Okay.
yes.
No swelling though, so that's good. And the wrists. Can you make some motions for me? Can you go up and down? Can you do that against resistance? Good. Good. Up like this and down. Same thing, do it against resistance. Up and down. Oh, you're really strong. Arms all the way up. Any pain in the shoulders when you do that?
No.
Okay. And can you bring them back behind you like this?
Yes.
Okay. Any pain with that?
Maybe a little bit of a tightness, but not
Nice.
pain.
Okay. You can relax for me. I'm going to have you do similar things with your hands. So lift your hands up for me and down. And don't let me pull you. And lift them up. And don't let me push you. Okay. Can you go in and out with your wrists? Like this. Okay. On this side. Very good. Check your cap refill while we're here. That looks fine. Just checking the skin on your arms. You said you had a few things removed. Anything from the arms?
No, from my legs and my tummy.
Okay, these all look fine to me. There's just a little one on the inside there, but again, all flat, all round.
Oh yeah, I had one removed from somewhere right here.
Okay. Looks like it's healed up pretty well, if that's the case. Just your arm for me. And nice and clear on the inside. I feel some pulses here. The pulse is a little bit deep. Is that normal for you to have a little bit of a weak pulse?
Usually I get heart palpitations sometimes.
Interesting. Those aren't quite as deep, but I do want to take your blood pressure just to make sure that you've got, you know, you mentioned those sort of anxiety
Sometimes,
palpitations.
yeah. Thank you.
Do you have an arm preference?
Yeah, I can do this one.
And slip that through. Tangle up here. Go ahead and relax your arm for me, please. And just breathe normally. This one's gonna just relax. All right, and just hold that for me for just a second here. Thank you. Okay, I'm just gonna set this right here with you.
Can hold it down.
And this arm just relaxes right on the, yep. Make it a little tight there. Is that okay?
Yes.
Okay. Blood pressure is 118/72, which is really good. So that's good. I just wanted to check that.
Thank you for that.
So as far as the pulses go, I'll continue to check as we move down, just make sure that there's circulation. But do you ever get cold hands and feet, tingling in the hands and feet? Okay,
Yes.
so that is not surprising to me with the pulse being a little bit weaker. And that's also not an indication of a connection to if you have a faster pace heart because of anxiety or something like that. It's not necessarily going to make the blood pump better to the extremities. So things that can help with that are just making sure your vitamins are all in check. So we might want to do some blood work as well as some, yoga, making sure your body is open and circulating properly. So I'm going to do the same sensation test, but on your arms.
Okay.
So again, close your eyes and just say yes when you feel it.
Yes. 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 Yes.
Can you flip this palm over for me, please?
Yes. Yes.
Good. Same thing on this side.
Yes. 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 Yes.
And flip the hand over.
Yes. Yes. Yes.
Perfect. And side to side, does that feel the same?
The same sensation, yeah.
Same sensation side to side?
Yes.
Here and there.
Yes.
Okay. And you didn't feel any less in the fingers like there?
Same sensation.
Same. Okay. So that's good. All right, let me grab the other tool here and we're going to do sharp or dull. So again, this sharp sensation here, you feel that
Yeah.
versus that?
Yes, very
Okay.
different.
Okay, so just tell me sharp or dull.
Sharp. Dull. Dull. Sharp.
Good.
Sharp.
Okay.
Sharp. Dull. Dull.
Good.
Dull. Sharp. 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 sharp,
And flip the hand for me, please.
dull, sharp, dull, dull.
Very good. And just look straight ahead for me and don't pay attention to what I'm doing. Okay. As long as I have this out, same thing. Does this feel cold like that? Same
Yes.
temperature?
Same temperature.
Same temperature here?
Yes.
Same temperature there.
Yes.
I'm going to draw something in your hand. It's going to be a letter. I want you to tell me what that letter is.
A.
Okay, and now it's going to be a number.
1.
Mm-hmm. And on this side, same thing. This one's going to be a number now, too.
3.
Okay, and then a letter.
T.
Perfect. Using the hands, I'm just going to move a joint up or down. Do you feel the difference there?
Yes.
Okay. Go ahead and keep your eyes closed and just tell me up or down.
Up, down, down, up,
Very good. Same thing on the other side.
down, up, up, up.
Awesome. So proprioception's intact. I'm going to give you an object to hold. Just want you to tell me what this object is. Keep your eyes closed.
Oh.
Let's try that again.
Tricky.
No problem. I'm going to give you an object to hold. Just tell me what this object is.
It's a feather.
Perfect. It's a feather pen, but close enough. All right, you can open your eyes now. I'm going to move down to your chest. For now, I'm just going to observe the heart. So you can just breathe normally. When you have those palpitations, do you get any shortness of breath, or do you feel pounding in your chest?
I always feel the pounding, and sometimes I get shortness of breath, but not too bad.
Not too bad. And how long does that normally last?
A couple of minutes.
Okay. Right now I'm going to have you take a deep breath every time I touch you with my stethoscope, okay? Okay. Good. Okay, lungs sound clear so far. I'm going to tap here. That all sounds normal. I'm going to have you say 99.
99.
Okay, one more time.
99.
And again.
99.
Okay, take a deep breath in for me. And out. Good expansion. Let me go ahead and have a listen on the back. Can you flip around for me, please?
Yes.
So again, I'm just going to have a listen, and I'll just have you take a breath every time you feel me touch you. And last one. Okay. Any pain when I hit you here?
No.
Right here?
No.
Take a deep breath in. And exhale. Good expansion. Say 99.
99.
Again.
99.
One more time.
99.
Okay. I don't hear any chest issues. I think that is definitely could be an anxiety reaction for sure. Just feel the spine. Just palpating here. Any pain when I press on here?
No.
I got the muscles on the other side here.
No.
You said there was some tightness in the shoulders.
Yeah. Around my shoulder blades.
Up here?
Yes.
Okay. Yeah, I can feel actually quite a big knot right there. You feel that right there?
Yeah, right there.
Yep.
That's the spot.
But there's good symmetry to your back. The spine is straight. That feels like muscle tension. You may want to see if your insurance covers massage. Well, many of them do. I think some massage therapy could be good for those tight muscles. There's some tight muscles right here as well. Okay, can you just tip to your right side? Okay, and to your left. And curl the head forward for me. And you can come back up. And just twist, yeah, like that. Any pain there?
No.
Twist to the other side. Does that feel okay?
Yeah.
All right. So, Luna, you can go ahead and lay your legs out long. I'm going to move down to the lower half of your body now.
Okay.
Okay, Luna, now that I have you down here, I'm going to take a look at your stomach. And you said no pain or discomfort in your stomach at this time?
That's correct, yes.
Okay. I'm going to just briefly... Do you mind if I just lift this up for 1 second? I just want to take a look. Okay. Good. No bumps or swelling. I'm going to feel the stomach here a little. I'm just going to go really light. Let me know if there's any pain. Any pain with this?
No pain, no.
Okay. You go a little bit deeper. Again, just take a deep breath in and then breathe out. Any pain with deeper palpation?
No pain.
Okay. Just going to check some pulses here. Okay. And feel for a couple things here. All right, that feels normal. I'm going to have a listen. Sounds good. I'm just going to tap here. Okay. Just checking the neck here really quickly while we're laying down. That's fine. Let's move on to your legs. Just going to feel the joints. Hip joint. Knee joint. Okay. Have you make some motions for me? Can you lift this leg off the table and put it down? Can you bend your knee and pull it up to your chest? Any pain with that?
No.
Okay, put it down. Same thing on this side. Leg up and in. Okay. I'm going to make a couple motions myself. Just relax. Is that tender or painful at all on the hip?
No.
That feels okay?
Yes.
Okay, can you push up against my hand? Good, and down. This side. And down. And put your knees upwards, your feet on the table. Yep, just like that. And resist me. Kick out. Good, same thing here. Any tension in the knees there when I do that? Pain? No. Okay. And you put your legs back out again. And just ankles up and down against resistance. Down, down, up. Push back on me. There you go. Like that. And then can you turn your foot side to side while holding that ankle there? Perfect. did hear a little bit of cracking, like you said, but nothing major. I'm gonna try get your pulses really fast, actually. Again, yeah, a little weaker in the toes, feet area. You said you had some coldness down here too.
Yes, all the time.
All the time. Okay. I'm gonna just touch you with the same cotton. You feel that over the leggings there?
Yes.
Okay. And just tell me yes when you feel it.
Yes. 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 Yes.
Okay. With the sharp or dull, are you able to feel the difference between that and that on the leggings?
Oh yes, definitely.
Okay, so tell me sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp.
Good.
Dull.
Okay.
Sharp. 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 Dull.
Very good. I'm going to stroke the bottom of your foot here. I'm just testing for a reflex. Just relax. Okay. Okay. Check a few other reflexes just while you're down here. So just bend your leg for me just a little, just sort of like that. Perfect. Okay, good. And on the other one, very good reflexes. Good. Just relax. Pretty brisk there, so that's a good sign. Since you have some of that coldness down there. We'll do your knees when you're sitting up again. Well, actually, I'll just try it. Give me the full weight of your leg. There you go. Now clench your teeth on the count of 3. 1, 2, 3, clench. You feel a little funny, right? Give me the full weight of your leg. And clench your teeth. 1, 2, 3, clench. Good. Look at your arms when you sit back up. And then, lastly, do you feel comfortable with me taking off your socks?
Yeah, of course.
Just want to check in between the toes there. No history of diabetes in the family?
No.
Just check quickly here. And the cap refill. Okay, that's fine. Something on this side. Right, yeah, definitely feeling that coolness, the temperature in the foot there. Right, Lena, go ahead and sit up for me. And just finish off with a couple of reflexes in the arms. Just give me the arm here and just completely relax. Give me all your weight. There you go. Good. Good. Again, relax. There you go. There. Perfect. All right, the reflexes are all intact. They look great. Just look at my notes here. Just make sure I didn't miss anything. So everything looks fine to me. I would say just come back in about 6 months, and I want to do another exam. Just make sure there's no continuation of the coldness in the hands and feet. Make sure that nothing is not getting worse or tingling or anything like that. And then, as well as, I want you to go get your blood work done. Okay, so I'll write you a script for that. Do you have any other questions for me today?
No, that's it. Thank you so much, Dr.
Okay.
Lee.
Thank you.